I was very attracted to nursing from the beginning. I was a candy striper when I was an early teenager at the local hospital. I worked as a nurse's aide in a nursing home when I was 16, and so I was just always on that career path. When I was a nursing student, I did a rotation on maternity, and that's when I got very enthralled with maternity nursing. I was doing a master's degree in nursing administration, which came in handy later. But during that time, I had to do a rotation once a week with a nursing leader. At the time, Patty Brown was a nurse midwife who was starting a nurse-midwifery service down in Cooperstown, which was about 40 miles from me. And so I called and asked if I could spend one day a week with her in a leadership position. The first day I spent with her was just mind-blowing because the nurse midwives would really be geared towards what did that mother want or need. It was very relaxed. And as the baby came out and rotated up, Patty kind of lifted the baby to the mom, and the mom reached down and pulled the baby up to her. And nobody screamed or yelled or, spanked the baby or hit their feet or did all the things to make them cry or all the things I had been taught as a nurse. I quit my job the next day, and I didn't go back to that type of nursing ever again. I just moved forward to become a nurse midwife. I was about 5 hours from the closest nurse midwifery school. Plus, it was very hard to get into nurse midwifery schools because they would only admit about 10 students at a time. I would have had to move to New York City. I had 3 little children by then, and I couldn't do that. So when this new distance learning program came on the horizon, it sounded like a dream. Could you really become a nurse midwife without leaving home? So I did enroll in the very first class of the distance education program. Immediately created this community of other nurse midwives who became my close friends, my collaborators, my colleagues. It gave me mentors such as Kitty Ernst to follow. And so it was absolutely life-changing for me. I was very into the clinical side of midwifery, and I never really thought I would venture into academics. That was not on my career path at all. But I did do a lot of mentoring of students, and then that grew to being a regional clinical faculty member. And the next thing I knew, I was teaching an antepartum course, and then I was, the clinical director for half the country, and only doing clinical half the time and doing that half the time, and things just grew. So when they needed a new leader at Frontier, they recruited me, and I told them that I would never leave New York State. So that was off the table. And so they said, well, would you do it for a while we look for someone? And I said yes, and I did it at a distance. Eventually, after a year, I agreed to take the job and relocate here to Kentucky. I just never got back to being a clinical midwife again. But I am a leader. I just know that I can do it. And that was what was needed more at that time than another clinical nurse midwife.
Sue's importance in those early days was such that I don't believe we could have ever pulled this thing off without her having hold of the reins of the organization. There were some very tough moments, and she got us through.
One of the things that was a decision that I made that I think changed the course of Frontier, and that was the decision to become accredited as an independent university. There was a lot of pushback. The board was kind of on the fence about it, whether to do it or not, but I felt that we would never go forward and probably would dissolve eventually if we didn't do this.
Working with Sue, one of the things that she has a huge skill set with is she understands the business piece. Great manager, but always watches the financing part of it. She understands return on investment and the importance of return on investment, but at the same time, she understood how to balance what students might need in the ways of support and scholarship and all those kinds of things. As her vision led to adding programs or enlarging the school, she would always kept a pulse on, are we doing what's best for our students? And are we going to have graduates that are really going to meet the need?
There was just so many pieces to the puzzle to put together, but we just went after those pieces one at a time until we did it. And so in 2004, we were granted accreditation as an independent university. And so that was probably the most important thing that I did for Frontier to move it into the future. Of course, I could have never pursued this career without the support of my family. I mentioned before that I had 3 small children when I first went to nurse midwifery school. And without my husband's help and support throughout that time, and then, of course, the idea of moving to Kentucky was huge. And yet he came here with me and supported me through every single thing that I ever did. So I have a wonderful family, and they have been so important to me being able to have the career that I've had.
I admired the tenacity that she had to be able to work full-time and take care of a family and go through a doctoral prepared program. So she's really been my mentor, and not only my mom, but she is also my best friend. And really the driving force behind my success. And I eventually went to school and got my Doctor of Nursing practice. I live in New York, and every now and again I will come across a nurse who is going for her nurse practitioner and either is attending Frontier or thought about attending Frontier at the time that they enrolled. And when I say my mother was the president of Frontier, they're like, oh my God, because it has such a really great reputation. And so it makes me proud when I find people like that around you and I'm able to say, oh yeah, that's my mom.
Sue has set such an amazing foundation. And it is so, in some ways it's overwhelming to come in after a president who's been serving for more than 2 decades. But also it makes the job really easy in some ways because, we're on such a great path forward. And we're fine-tuning and building and imagining new things because we have that firm foundation.
It was just an amazing time. All the changes we went through, and all the growth of the university and the curriculum and the people, everything. It was an amazing time. It was a privilege to be a part of it.